Hello everybody, welcome to Kovai Post. I'm Dr. Karthik, the Orthopedic Surgeon in Global Ortho Trauma Hospital, Ramnagar, Coimbatore in South India. Now we're going to talk about tennis elbow today. It's a sharp pain along this part of your elbow, which is a common condition seen in every orthopedic clinic. Now this is because of overuse of your forearm muscles, which leads to pain in outer side of your elbow. It's very common and it's sometimes so frustrating. The pain is really annoying and quite agonizing at times. And simple tasks you might find it very difficult to do, especially in ladies in the house. You know, when they're cutting using a kitchen knife to cut vegetables, they'll find it very difficult to grab on it. Or carpenters, electricians, people who work with a screwdriver, and sometimes in the bank, people who do a lot of counting the money, school teachers who do write with the chalk on the board, or use to correct a lot of papers, and software professionals who play with the mouse. And these are some of the professionals, but not surprisingly, almost all sports people can develop this, not just tennis players. And there's quite few things you could do to help yourself before you go on to painkillers, injections into the painful spot, or sometimes even operation. There are arthroscopic procedures done nowadays to relieve pain. But the simple things first. There are certain stretching exercises. There are strict do's and don'ts you're supposed to follow. And remember, this is an overuse pain. You're doing something too often that is bringing this pain. And all you have to do is just stop that, or reduce doing it, or do it in a different way so the pain comes down. That's the most important thing. Thank you.
Hello, I'm Renuka, Chief Physiotherapist in Global Ortho Hospital. This gentleman is having pain in elbow joint. So where do you have pain? He's having pain in this elbow joint. Now we are going to give treatment to reduce the pain in elbow by a few exercises and stretching, and also a few modalities which can relieve the pain. Keep your elbow straight. Yes. And keep your fingers up. Yes. Pull it up. Hold it for a few seconds. Do you feel tension here? Do you feel pulling sensation is there? Yeah. Keep your elbow straight. Don't bend it. Yeah. Like this only you have to keep your elbow straight. Don't bend it while doing exercise. And keep it for a few seconds and release it. Yeah. Again do it. Pull it for a few seconds and free it off. And same thing. Just keep your hand down. Yeah. Same thing. Elbow should be straight while doing this exercise. Yeah. Pull your fingers back. Hold it for a few seconds. Yeah. Leave it off. Yeah. Again do it for a few seconds, and then you can leave it off. Yeah. That's good. You have to continue this exercise morning and then evening.
So we saw some stretching for tennis elbow. Did that give you some pain relief? Did you feel better? Yes. Good. Now, there are other techniques as well used in the physiotherapy department, like an ultrasound therapy. They also use some specialized needles to relieve pain, and manipulative therapy. And these are something that's regularly done in our department here, physiotherapy. Now, remember, don't make this diagnosis yourself. See a local doctor. Make sure that it is tennis elbow before you start doing this. And remember, exercise is the most important part of treatment. Thank you.